India is in the midst of a devastating second wave of COVID-19. For the past several weeks, cases and deaths have skyrocketed, leaving both medical facilities and crematoriums overwhelmed. The humanitarian catastrophe unfolding in the country has caused great concern across the globe, and supplies from the international community are flying into India to relieve the crisis. Research suggests that the surge of infections in India may be partly attributed to two new strains of the virus, B.1.617 and B.1.618, that first appeared in India. There is truly an explosion of COVID infections in India right now. On May 1st, reports showed that India recorded its highest single-day rise in infections, with 401,000 new cases in just 24 hours, taking India's total infections to over 19 million. According to the World Health Organization's weekly epidemiological update on COVID-19 issued on April 27th, new global COVID-19 cases increased for the 9th consecutive week, with nearly 5.7 million new cases reported in the last week. This surpassed previous peaks, and India accounted for 38% of all cases. There have been 4 days in a row since April 27th where daily fatalities were around 3,500. The deadliest day was April 28th, where there were 3,647 total deaths, or 2.5 deaths every minute, pushing the death toll past 210,000. However, experts believe the official numbers vastly underestimate the actual toll on the nation of 1.35 billion people. The most heavily hit area is Delhi. The official death toll there has been just over 300 per day, but according to the mayor of the North Delhi Municipal Corporation, Jay Prakash, Delhi's crematoriums have been cremating more than 600 bodies daily for the last week. Yes, the reported deaths are about 300, but we are definitely having to cremate more than 600 daily. They are deliberately underreporting deaths, the mayor told CNN on April 28th. The unprecedented rush of bodies has filled up all crematoriums across Delhi, and people have been forced to skip funeral ceremonies and rituals. Ambulance after ambulance waits in line to cremate the dead outside graveyards. Burial grounds are running out of space in many cities, and authorities are getting requests to start cutting down trees in city parks for kindling. Bodies are being burned in makeshift crematorium facilities in parks and parking lots on rows and rows of funeral pyres. With long lines and even longer waiting times outside crematoriums, wood for burning funeral pyres in Delhi is running out. North Delhi Mayor Prakash wrote to Delhi Chief Minister Kejriwal on April 27th, asking him to direct the Forest Department to supply firewood to crematoriums timely. He wrote, "Kindly give appropriate directions to the Forest Department so that the crematoriums can continue doing their work uninterrupted and the bereaved families are not put through any kind of trouble." In the central city of Bhopal, some crematoriums have increased their capacity from dozens of pyres to more than 50, yet there are still hours-long waits. "The virus is swallowing our city's people like a monster," said Mamtesh Sharma, an official at a crematorium in the city. "We are just burning bodies as they arrive. It is as if we are in the middle of a war." The record surge of cases is collapsing India's tattered healthcare system, worsened by shortages of hospital beds and medical oxygen, the life-saving gas. Outside hospitals, people are lining up on trolleys, in cars, and in cycle rickshaws, with loved ones holding oxygen tanks for them as they wait for a bed inside. The shortage of oxygen is the main concern, Dr. K. Pritham, an administrator at the Indian Spinal Injuries Center, said to Reuters on April 27th. "For 7 days, most of us haven't slept. Because of the scarcity, we are forced to put 2 patients on 1 cylinder, and this is a time-consuming process because we don't have long tubes." As early as April 22nd, the Indian Express reported that Max Healthcare Network had sought urgent intervention from the Delhi High Court, saying that most of its hospitals were working on dangerously low levels of oxygen supply. After a hearing, the court assured the healthcare center unobstructed passage of oxygen tankers to Delhi from other states. "Beg, borrow, or steal. It is a national emergency," said the division bench of justices of the court. Industrial oxygen manufacturers are being encouraged to produce medical oxygen. Delhi High Court came down to Max Healthcare Center, saying, If the result is that those industries have to shut down for some time till you make alternate arrangements, so be it, because we cannot afford to lose lives. That is the bottom line. Afterwards, the Supreme Court demanded to see a national plan on the supply of oxygen and essential drugs. On April 26th, India Today reported that Chief of Defense Staff General Bipin Rawat briefed Prime Minister Modi that all medical personnel from the armed forces who have retired or taken premature retirement in the last 2 years are being recalled to work in COVID-19 facilities near their present place of residence. Apart from this, Prime Minister Modi was also briefed that oxygen cylinders available for armed forces in various establishments would be released to hospitals, and wherever possible, military medical infrastructure would be made available to civilians. It was reported the first oxygen express train to Delhi carrying around 70 tons of the life-saving gas from the eastern state of Chhattisgarh reached the national capital early April 27th. Disturbing videos from India and a rising death toll have made global headlines and prompted an increasingly urgent response from countries around the world to provide critical aid, especially to meet the crucial need for oxygen. On April 29th, India Foreign Secretary Shringla told a news conference that India has prioritized imports of oxygen and 40 countries had pledged their support. We are taking about close to 550 oxygen-generating plants that are going to come in from different sources from all over the world, he said. Responding to the needs, Britain has been the first country to provide practical support. In total, Britain is sending 495 oxygen concentrators and 200 ventilators to India. On April 27th, 100 ventilators and 95 oxygen concentrators arrived in New Delhi, with more of those supplies coming soon. An Indian Foreign Ministry official said France is sending 8 large oxygen-generating plants, and Ireland, Germany, and Australia are sending oxygen concentrators and ventilators, underlining the crucial need for oxygen. The World Health Organization also said it was working to deliver 4,000 oxygen concentrators to India. These devices concentrate oxygen from ambient air. On April 28th, Britain announced it was sending 3 oxygen generation units to India following a first consignment of aid. The 3 units, dubbed oxygen factories, are each the size of a shipping container and can produce 500 liters of oxygen per minute. British Foreign Secretary Robb said in a statement, "International collaboration is more essential than ever, and this additional UK support package will help meet India's current needs, particularly for more oxygen." According to the Canadian press, Canada said it has procured 2.7 billion pieces of personal protective equipment, with 1.5 billion pieces already delivered to India. Prime Minister Trudeau said on April 28th that Canada is also ready to provide $10 million through the Canadian Red Cross to the Indian Red Cross. Trudeau said, "This will support everything from ambulance services to buying more PPE locally." According to TASS on April 28th, the Russian Emergencies Ministry was sending aircrafts to India carrying over 22 tons of humanitarian aid, including 20 units of oxygen supply equipment, 75 artificial lung ventilation machines, 150 medical monitors, and 200,000 packages of medicine. The 2 planes were reported to have arrived at Delhi Airport on the morning of April 29th. According to Reuters on April 28th, Germany will send 120 ventilators to India the coming Saturday, followed by a mobile oxygen production facility the next week. Up to 16 German soldiers will help set it up and instruct staff of the Indian Red Cross in its operation. According to the Hindustan Times, Italian Prime Minister Draghi said on April 28th that Italy is prepared to send an oxygen generation system with specialized personnel as part of the European Union's efforts to bolster India's response to the surging infections. According to an EU press report, Ireland, Belgium, Romania, Luxembourg, Portugal, and Sweden are sending oxygen concentrators, ventilators, and doses of antiviral medicine remdesivir to India through the EU Civil Protection Mechanism. According to Reuters, the United States is sending supplies worth more than $100 million to help India. The supplies began arriving on April 29th and will continue arriving into the next week, including 1,100 oxygen cylinders, 1,700 oxygen concentrators, 50 million N95 masks, 1 million testing kits, and 20,000 treatment courses of remdesivir. According to the White House, the United States has also redirected its own order of AstraZeneca manufacturing supplies to India, which will allow it to make over 20 million doses of the COVID-19 vaccine. Even China, locked in a year-long military standoff with India over their disputed Himalayan border, said it was trying to get medical supplies to its neighbor. According to Times of India, however, China's state-run Sichuan Airlines has suspended all its cargo flights to India for 15 days, causing major disruption to private traders' efforts to procure much-needed oxygen concentrators and other medical supplies from China. There are also complaints of Chinese manufacturers jacking up prices by 35 to 40%. Freight charges have also increased by over 20%. On May 1st, the official microblog of the Political and Legal Affairs Commission of the Chinese Communist Party released a combined picture titled China Ignites versus India Ignites with the hashtag of the Indian epidemic, suggesting that China ignites to launch rockets, India ignites to cremate corpses, mocking the Indian crisis. Many Chinese netizens found it inhumane and despicable. Although international responses are bringing some relief to the crisis in India, it seems the terrible situation will linger for some time. According to the Hindu report on April 27th, the Indian Institute of Technology's Campo and Hyderabad campuses predict that the second wave of the COVID epidemic in the country will reach its peak between May 14th and 18th. The highest number of active infection cases may reach 4 million, and the number of new cases in a single day may reach 440,000. Researchers pointed out that India is expected to see a sharp decline in the number of active infection cases in late May. What caused such an unprecedented spike of infections in India? Experts say that one of the factors behind it could be the newer variants of the virus, namely B.1.617 and B.1.618, which have been popping up in various parts of the country, with earliest identification in October 2020. Genomic analysis has revealed that B.1.617 has mutations that are associated with increased infectivity of the virus, and B.1.618, with even more mutations, has the ability to escape the immune response and could be more infective. The online database GISAID revealed that B.1.617 has caused 28% of infections in India. B.1.618 is the third most common variant sequenced in the last 30 days in India and has caused nearly 12% of all infections. Another commonly sequenced variant across the country is B.1.1.7, or the UK variant of the virus. Apart from these variants, other variants from Brazil, South Africa, and the UK are also prevalent across India. According to the WHO, variant B.1.617 has been present in at least 17 countries, and mostly in India, the UK, the USA, and Singapore. B.1.618 has been found in samples outside India from countries like the US, Singapore, Switzerland, and Finland. It was reported on May 1st that cases of the Indian COVID-19 variant had been detected in China as well. Chinese netizens have posted comments such as, "The CCP has all the strains, and all the strains come from there. The virus is actually a variant of the CCP virus." Beijing claimed that the so-called Indian variant of the virus had spread to China, but in fact it was the Wuhan virus returning home, and so on.